So when we're looking at the Portland test, we're assessing basically load transfer of the center of gravity, or how the lower extremity handles load transfer through displacement of the center of gravity anterior. So typically what we want to do, so go ahead and face this way if that's good. So I think that'll be better. So what we're going to do at first is just watch our patient step forward and back, a normal walking step. So I just have them go back and forth a few times, and I'm looking to see if there's any drop, deviation, harder heel strike, and imagine that as walking several times a day. So we look for that extra drop. Now you can stop for a second. Now bring this leg forward for me. Good. When we get into this stance phase, and if somebody is unstable when you push, and so the Portland test itself, which was designed by Cliff Fowler, one of our founding faculty members who's now retired, he was doing it looking at the SI joint. Two different places, an anterior posterior motion, and then around S3 a little bit more of a lateral motion. Fast forward 20 years, what we want to say is that, okay, when you're in stance phase, getting ready for push-off, a lot of things have to happen, and if you don't control your center of gravity, and that could be through automatic neuromuscular control here, then you're going to get unstable. If you have a mobility restriction, anywhere between here, and down to the ankle and foot, including dorsiflexion, your neuromuscular system might not be able to control it. So what we're looking for, come on back again, is just at first, just step back and forth again, is we're looking for a nice smooth motion, and then sometimes we'll see when she brings it through, there's a little bit of a drop. Then we get into double stance phase, and then we just check by displacing the center of gravity forward if there's any imbalance. Now go ahead and bring the other leg forward. Okay, that was good. So you saw the difference there. And now if we displace the center of gravity, she actually has a loss of balance. So when she's pushing off on the right and moving weight to the left, she has decreased neuromuscular control. So our goal, through addressing an issue somewhere between here and here, is to make sure her push off of gait and heel strike is controlled, so she's not putting extra stress on this area. So that's the goal of the Portland test. In my opinion, it's a functional test. It's called the Portland test because Cliff didn't name it after himself. He was in Portland, Oregon. So it's the Portland test. I think of it as a functional load transfer test. Erwin McCader just did a poster presentation on this at the American Academy. And what we did was take the cluster for gluteal tendinopathy, because if you can't transfer load well, you might shift over to one side or the other. And so we took Grimaldi's cluster for gluteal tendinopathy and combined it with this test, and it seemed to match up very well. At least in preliminary stages, there's going to have to be more research done. But at the end of the day, if the person is unstable in a phase of gait like that, multiply that times 5,000, 10,000 steps a day, 5,000 heel strikes on this side, it adds up over time. So with your patients, you need to address this functionally through whatever rehab program you're going to do.